You hear that, Cody? Rain. Perfect time to cozy up with a book. Let's talk. Hi, and welcome back to Pocketbook Pediatrics. I'm Dr. Richland Brown, and as usual, I'm always so happy to have you here with me today. Now, there's been a buzzword that has been going around. I wonder if you can tell me what it is. Yeah, dengue. We've been hearing a lot about dengue infection here in Jamaica over the last couple weeks to maybe couple months or so. And I wouldn't be surprised if it's happening in other areas as well, as we're in this hot and muggy kind of rainy season now. So let's talk a little bit more about that. So first off, what is dengue or dengue fever? Now, dengue fever is an illness that is caused by the dengue virus, of which there are 4 members of the family. So there are 4 types of dengue virus. Now, I know we're familiar with the idea of if you're infected with one type of an infection or one member of the family, it can protect you from illness from other members of the family later down the road. But that's not the case with dengue infection. And actually, it's the opposite way around. So if you're infected with one type of dengue, and then you get a second infection of dengue, that second infection tends to be a worse course of illness than the first one. So it's important for us to know how we manage and how we prevent dengue from happening altogether. Now, how do we get dengue infection in the first place? We're all familiar with mosquito bites, and we're going to talk about that shortly. But there are other ways that you can get the dengue infection. One of which is from a pregnant mother to her unborn baby. You can also have dengue virus if it's present in the blood products you receive for a blood transfusion. But let's talk more about the one that's most common to us, and that is mosquito infection. So dengue virus is most often passed on by the bite of a mosquito, and particularly the Aedes aegypti or Aedes albicans mosquitoes. And you may say, well, Dr. Brown, why is that even important? Why are you telling me that? But I tell you because we can identify the different mosquitoes if we take the time to look. Now, I'm sure we've all seen like all black mosquitoes, but these mosquitoes, they tend to have white stripes going down the body and the legs. So if you've been bitten and you happen to catch that pesky bugger and you look at him, you might be able to say, was this a dengue carrying mosquito? Could it have transmitted dengue? Should I be looking out for any symptoms in myself or in my children if they were bitten? Right? So now, what are the symptoms of dengue fever? Now, dengue fever, as it says, may cause a fever and rash. And these symptoms may start up anywhere from about 4 to 7 days after that mosquito bite and may last anywhere from 1 to 2 weeks from the onset of the symptoms. Now, along with fever and rash, there are other symptoms that may occur. And let's go from head to toe so that we don't miss anything out. Now, for the head, you may have a headache, or your child may have a headache, and you may notice red eyes. They may complain of pain behind the eyes. Moving down to the nose and throat, they may have a runny nose or a stuffy nose. They may complain of a sore throat, and when you look in the mouth, you may notice some redness to the throat. Moving down to the chest area, they may have a bit of a cough. And then moving down to the tummy, they may complain of nausea and have vomiting or diarrhea. And they may have feelings of just feeling tired and just having what we call malaise, or they may complain of joint pains. Now, you might say to me, Dr. Brown, nothing that you have said to me has told me that my child has dengue. And I would say, bravo, you could be a pediatrician. I agree with you. Many of the symptoms of dengue are very, very similar to other types of viral illnesses. So none of those general symptoms that happen in mild dengue can definitely tell me that this is dengue fever. When we begin to have a bit more of an idea that this might be dengue is when it begins to show symptoms of affecting how your blood clots or causing symptoms of bleeding. And these symptoms of bleeding can happen in different ways in different areas of the body. Now, the dengue virus begins to become a concern to us for causing severe illness when it affects the platelet levels in the body. These platelets are the part of your blood that help your blood to form clots that will help you to stop bleeding when you get a bruise or a cut. And the dengue virus can make these platelet levels very low. And we begin to see that something might be wrong with the platelets in different areas of the body when we see things like a rash on the body. Now, this rash is different from the general rash that you can get with viral illnesses because it looks like red pinpoints under the skin. And this can show us that the capillary vessels or the small blood vessels under the skin are having areas where they're a little bit leaky because the platelet levels are low. We can also see easy black and blue bruises, and you may say, how did your child get that bruise? You didn't expect them to have a bruise. They didn't have any episodes of trauma or bouncing into anything that you know of, and they have these areas of bruising or black and blues on their body. It may look purple or blue. They may have episodes of nosebleeds, and they don't generally have nosebleeds, and you wonder, how come they're having a nosebleed now? And you want to also look for evidence of bleeding in their urine or in their stool, or if they have vomiting in what they throw up as well. You want to check that if there's any blood there. Another way that dengue can have severe symptoms as well that may not show you on the outside that there's any bleeding or anything happening is your child may begin to complain of abdominal pain. So that's a serious sign that dengue is getting very serious and you do need to see a doctor. And your child also could have seizures, which can be related to the vomiting and diarrhea. Maybe there are changes in the salt levels in the body, but also can be related to possible bleeding around the brain. So it's important, if you see any of these signs, to definitely take your child to be seen by their pediatrician. Now you may ask, well, Dr. Brown, do I wait until these things happen, or do I monitor my child at home, or what is the right time to go and see the pediatrician? And that's a good question. And I would say, if you have any suspicion at all, whether the symptoms are mild or they're looking like they're getting a little bit more serious, if you suspect that your child has dengue, that is the time to take them to see their pediatrician. Because your pediatrician will be able to do a full exam, they'll be able to assess their tummy, they'll be able to sometimes provide a rapid test in office that they can check to see if there's a suggestion of dengue infection, and they will also definitely be able to do other blood tests that can check those platelet levels to see if they're low, and can also check specifically for dengue infection or other types of viral illnesses that, as we said, can cause similar symptoms to dengue. So it's important, if there's any suspicion at all, take your child to the pediatrician. Now, it's also important to say that you have to keep in mind that your pediatrician may feel it necessary that your child may need admission to hospital. So I want you to keep that in mind so that you're not surprised if that conversation comes up. And to keep in mind that maybe I should pack a little bag and just be prepared in case they say that we need you to go to hospital. Sometimes just for observation to make sure that there's no worsening of their symptoms, or sometimes to treat things that already seem to be moving in the direction of showing your child has severe dengue and needs some further treatment. None of us really want to admit your children to hospital, but we all want to be safe rather than sorry. So keep that in mind that, hey, maybe I might be told I need to go to hospital, and so I won't be surprised about it. I'll have a little bag ready and I'm prepared to go. Your next question might be, well, Dr. Brown, now we have dengue infection on board. It's a mild infection. How can I go about treating this infection now? Well, first I would say there's a Caribbean adage that says prevention better than cure, meaning, it's better to prevent something from happening than to have to deal with making it better or treating it once it's already occurred. And that, I think, is important to say for dengue infection. If we can prevent infection altogether, it's better than having to deal with managing it at all. So what are some of the ways that we can deal with prevention of dengue infection? Well, first, we can keep ourselves protected, and we can do that with clothing by making sure that we're wearing long sleeves and long pants to keep those exposed areas of skin down to a minimal amount. We can stay inside when we know that it's mosquito time, as my nephew likes to say. But mosquitoes do tend to come out at particular times, at the dusky time and in the dawn time of the day. And repellents are able to be used as well. And they come in different forms, as sprays, lotions, oils, sometimes there's a mosquito band that may be worn. All we want to know is that you use a DEET, that's DEET, containing repellent. They're safe to use in children from 2 months and older, and it's safe to use a repellent that has up to 30% of DEET for your kids and for yourself. Now, for our teeny beanies who are less than 2 months, that wouldn't be a solution for them. The best option for them is really to keep them covered and keep them inside. But once they're a little bit older, you can go ahead and use a repellent. And for the smaller ones who need our help, or toddlers or infants or young children, to get that application, it's best that you put it in your hands and then use your hands to rub it on their bodies. If you're putting any on the face, it's just a very small amount, and be sure to avoid the eyes and the mouth, and you want to avoid putting it on their palms as well. Be sure to read the instructions and follow the instructions very, very carefully for how to apply and how often to apply. You also want to make sure that you use nets over the bassinet, nets over the crib, nets over the bed, particularly around bedtime, so that you can have a peaceful sleep without having to worry about any mosquito bites. And of course, you want to make sure that your environment is one that's safe and not promoting the breeding of mosquitoes. So you're gonna make sure that the grass outside is low, the hedges are low, you're not having any containers, whether those be containers, standing containers that you place, or old tires or cups or anything else that can collect water, that can now just be standing water and be an area where mosquitoes breed. So be sure to check out your garden and make sure that there's no standing water for mosquitoes to be breeding around their environment. Now, of course, we also have to address the symptoms that your child may have. So if your child is having fever or pain, it's important that you only use acetaminophen, or what we call Panadol or Tylenol or Cetamol. Those are medications that are safe to use for dengue infection. And why do we say that? We say that because other medications, the NSAIDs, things like Cataflam or aspirin, they can actually make your bleeding worse if you have bleeding on board. And we don't want that at all. So even if you think this is a mild course of dengue, I don't really see any signs of bleeding, it's still important to know. Only use your Panadol, Tylenol, Cetamol. Your acetaminophen is the right name of the medication for treatment of any of those symptoms that you have. And of course, you want to make sure that you keep your kids well hydrated, lots to drink, juice and water. They may not be so fussy about having anything to eat right now, and that's okay, as long as they're keeping very well hydrated. Their appetite will come back once they begin to feel better. If they're having vomiting and diarrhea, it's also very important to replace those fluids. So you want to use oral rehydration salts. We do have a video on gastroenteritis that can help you with that, and just managing vomiting and diarrhea. I'll leave that link down below so it's easy for you to find. And of course, lots and lots of rest, just like other viral illnesses as well. It's important to get rest. Antibiotics are not appropriate for the treatment of dengue infection because it is a viral infection. So antibiotics which treat bacteria will not treat the dengue infection. It will run its course, and over the next week or two, as you said, will begin to feel better and it will be out of your system. So just give it time. And of course, if you have any concerns, reach out to your pediatrician. That's all for Pocketbook Pediatrics today. I hope you understand a little bit more about dengue infection and really the seriousness of dengue infection and how severe illness can actually be. And remember, be prepared that you might hear that your child needs to be admitted to hospital, but admission to hospital is better to be safe than to be sorry that we had not followed more closely. And sometimes all we need is a bit of observation. Sometimes it may need a little bit more management. So just be prepared for that possibility when you go and see a doctor. And remember all the different ways that you can keep your environment mosquito free, because prevention is better than cure. Thank you so much for watching. If you've been enjoying Pocketbook Pediatrics, please remember to like, comment, subscribe, and share. I would love to hear what repellents you're using now. It might be, you might have a brand that works better for you than another one. And that comment might just be the help that another mommy or daddy needs to get the relief that they need at home. So I'd love to hear from you. I'd love to see your comments. Please place them down below. Thank you so much for watching. And I look forward to seeing you the next time on Pocketbook Pediatrics. God bless.